I think the number one reason for chronic low back pain is not that we have failed low back syndrome. It's failure to diagnose and treat the patient properly. Because if you're treating the wrong thing, you're not going to expect an outcome. I mean, I'm a car guy, and I use those analogies throughout my lectures. I'm always comparing something back to a car. So take, for example, or let's say, for example, you bring your car to a car dealer because you step on your brake pad and your foot vibrates and your steering wheel shakes when you step on your brakes. So you tell the service writer, I step on the brakes and my steering wheel vibrates and my pedal vibrates. Well, he's already thinking, because you gave him the symptom, they're already thinking about the possible diagnosis causes for that. They're going to bring the car back and they're going to say, well, it sounds like rotors. So they're going to replace the rotors. And then if you get your car back and you step on the brakes and everything works, you say you fixed the problem because you replaced the right part, we're good. What happens if you get your car back and you step on the brakes and it still shakes? Do you call it failed brake syndrome? Not really. So if you operate on a low back because you suspect the patient has a disc pathology that you might not have done a thorough exam to determine whether or not it's symptomatic for to begin with, and the patient doesn't get better, maybe that wasn't the pain generator to begin with. So we take these patients, we better diagnose them, try and determine what might be the pain generator, come up with a targeted approach for that patient, and all of a sudden we're making pain on patients even with post-op low back pain, which is my 50% of my patient population, and we're making that pain go away. Not managing it, we're making it go away. So I think the number one reason for chronic pain, or why acute pain becomes chronic, is failure to adequately diagnose.